The patient was dying. The surgeon was 10 minutes away. But the night shift nurse did something that left the entire medical team speechless. Her hands moved with precision they'd never seen before, using techniques that shouldn't exist outside of operating rooms. "How did you?" the resident whispered. She looked up with eyes that had seen things no civilian ever should. "Some things you never forget," she said quietly. But what those things were would change everything they thought they knew about the woman who'd worked beside them for 3 years. Welcome to Hidden Legends. Before we dive into this incredible story of hidden service and extraordinary courage, tell me in the comments which city you're watching from today. And if you believe stories like this deserve to be told, hit that subscribe button. Because what you're about to discover will change how you see the people caring for you in hospitals everywhere. Rachel Martinez was invisible in the best possible way. For 3 years, she'd worked the night shift at St. Mary's General Hospital, moving through the corridors like a ghost. Patients trusted her immediately. Doctors relied on her without question. Other nurses respected her quiet competence. At 34, Rachel had perfected the art of being unremarkable. She arrived at 7 p.m. sharp, tied her dark hair back in the same simple ponytail, and disappeared into the rhythm of night shift nursing. Room checks, medication rounds, paperwork. The same routine, night after night. "Rachel's like a machine," the other nurses would say. "Never rattled, never stressed, just steady." But machines don't have nightmares. And Rachel Martinez had nightmares that would terrify most people awake. She'd chosen night shifts deliberately. Fewer questions in the dark, fewer eyes watching her work. And when the flashbacks came, the sound of helicopter rotors, the smell of dust and smoke, the weight of someone's life in her hands, she could handle them alone. Dr. James Wilson, the head of emergency medicine, had noticed something different about Rachel from her first week. Her medical knowledge seemed deeper than her resume suggested. She anticipated his needs before he voiced them. She handled trauma cases with a calmness that took most nurses years to develop. "Where did you train before coming here?" he had asked during her 6-month review. "Different places," Rachel had replied, the same answer she gave everyone who asked about her past. The truth was locked away so deep that even Rachel sometimes forgot it was there. Until nights like tonight, when that past would explode back to the surface with the force of an IED blast. What nobody at St. Mary's knew was that Rachel Martinez had another name once. Staff Sergeant Rachel Santos, United States Army, 68W Combat Medic Specialist. Not just any medic, an 18D Special Forces Medical Sergeant, one of only 47 women to ever complete the training. She joined the Army at 19, driven by a need to serve that she couldn't explain to her family. Basic training had been tough, but medical training had been her calling. Advanced individual training, Combat Medic Specialist course, Special Operations Combat Medic. Each level had pushed her further from the quiet girl from Phoenix and closer to something she never knew she could become. Her first deployment was Afghanistan, 2015, Forward Operating Base Chapman, Coast Province. She was 22 and terrified, but her hands never shook when lives depended on them. Gunshot wounds, IED injuries, combat stress casualties. Rachel had seen it all before her 23rd birthday. The second deployment was different. Embedded with special forces, she'd operated in places that didn't appear on any official map. Her medical skills had evolved beyond textbook procedures into something more instinctive, more lethal in their precision. She could perform emergency surgery with nothing but a flashlight and battlefield improvisation. But it was the third deployment that changed everything. Syria, 2018. A classified operation that officially never happened. Rachel's team was tasked with providing medical support to a joint task force targeting high-value insurgent leadership. It should have been routine. Establish a field medical station, wait for casualties, patch them up, send them home. Instead, they walked into an ambush that lasted 18 hours. When the dust settled, Rachel had performed 7 emergency surgeries under fire, kept 3 critically wounded soldiers alive with no blood supply, and carried a wounded teammate 2 miles to the extraction point. She'd saved 11 lives that day. 11 men who went home to their families because a 25-year-old woman from Phoenix refused to let them die. The Army wanted to give her a medal. Rachel wanted to forget it ever happened. PTSD doesn't announce itself with fanfare. It creeps in through the back door of your mind and rearranges the furniture while you're sleeping. For Rachel, it started with insomnia, then hypervigilance, then the flashbacks that could turn a helicopter overhead into a full-scale combat scenario in her mind. The Army offered help, counseling, medication, a desk job stateside. But Rachel knew she was done. She'd given everything she had to give, and what came back wasn't the same person who'd enlisted 6 years earlier. She'd used her GI benefits to complete nursing school, channeling her medical training into civilian health care. It seemed like a natural transition, helping people heal, using her skills for peace instead of war. But hospitals weren't battlefields, and civilian medicine followed rules that sometimes felt impossible after years of improvisation under fire. The first few nursing jobs hadn't worked out. Too many questions about her background. Too many curious colleagues wondering why she knew so much about trauma care. Too many moments when muscle memory kicked in and she performed procedures that civilian nurses weren't supposed to know. St. Mary's had been different. They'd needed a night shift nurse and hadn't asked too many questions about her experience. The work was steady, the patients needed her, and the darkness provided cover for the ghosts that followed her from deployment to deployment. For 3 years, it had worked. She'd found a rhythm, a purpose that didn't require explaining where she'd learned to stay calm while someone was dying. She was just Rachel Martinez, night nurse. Quiet, competent, invisible. Until tonight, when staying invisible became impossible. The call came at 2:47 a.m. Code Blue, Trauma Bay 2. Code Blue, Trauma Bay 2. Rachel was finishing medication rounds when the announcement echoed through the hospital corridors. Code Blue meant cardiac arrest. Someone's heart had stopped, and they had minutes to bring them back before brain damage set in. She arrived at Trauma Bay 2 to find controlled chaos. Dr. Sarah Mitchell, the night attending, was leading CPR compressions while respiratory therapist Mike Torres managed the airway. The patient was a 38-year-old construction worker who'd come in with chest pain an hour earlier. "How long has he been down?" Rachel asked, slipping into position. 3 minutes, Dr. Mitchell replied between compressions. No response to initial resuscitation. Rachel looked at the monitor. Flatline. No electrical activity, no pulse, no signs of life. Standard protocol called for continued CPR, medications to stimulate the heart, and hopes that something would work. But Rachel's trained eyes saw something else. The patient's neck veins were distended. His skin had a grayish pallor that spoke of more than cardiac arrest. And when she placed her hands on his chest to check compression placement, she felt something that made her blood run cold. "Stop compressions," she said quietly. "What?" Dr. Mitchell looked up, confused. "Rachel, we need to continue." "Stop. Now." Rachel's voice carried an authority that made everyone in the room freeze. "This isn't cardiac arrest." She moved to the patient's right side, her hands already reaching for equipment that wasn't part of standard Code Blue protocol. From the crash cart, she pulled a large-bore needle and syringe, tools that were supposed to be used only by physicians. "Rachel, what are you doing?" Dr. Mitchell demanded. "Tension pneumothorax," Rachel replied, her hands moving with surgical precision. "His lung collapsed and it's putting pressure on his heart. That's why CPR isn't working." She positioned the needle between the patient's ribs, angling it just below the second intercostal space. This was a procedure she'd performed dozens of times, but never in a civilian hospital. Never as a nurse. "You can't do that." The newest resident, Dr. Martinez, stepped forward. "That's a physician-only procedure." Rachel met his eyes with a gaze that had stared down insurgents in 3 different countries. "Would you rather he die while we wait for the surgeon?" Before anyone could answer, she inserted the needle into the patient's chest cavity. There was a sharp hiss as trapped air escaped, immediately relieving the pressure on his heart. The cardiac monitor came alive. Beep, beep, beep. The patient gasped, color returning to his face as his heart resumed its normal rhythm. The trauma bay fell silent except for the steady beeping of the monitor and the patient's labored but steady breathing. How did you? Dr. Martinez whispered, staring at Rachel like she'd just performed a miracle. Rachel looked up from the patient, her hands still steady as steel. Some things you never forget, she said quietly. But the way she'd moved, the precision of her technique, the calm authority in her voice, these weren't things you learned in nursing school. Dr. Mitchell had been practicing medicine for 15 years, and she'd never seen a nurse perform emergency thoracostomy with that level of skill. Rachel, Dr. Mitchell said slowly, where exactly did you train? The patient was stable, transferred to intensive care with a chest tube draining the remaining air from his pleural cavity. The immediate crisis was over, but the questions were just beginning. Rachel found herself in the break room at 4 a.m., sitting across from Dr. Mitchell and Dr. Martinez. The coffee was cold, but nobody seemed to notice. That procedure you performed, Dr. Mitchell began carefully, that's not standard nursing training. No, Rachel agreed, her hands wrapped around her coffee cup. It's not. So where did you learn it? Rachel was quiet for a long moment, staring into her coffee like it might hold answers she wasn't ready to give. In the 3 years she'd worked at St. Mary's, she'd never talked about her past. Not to colleagues, not to friends, not to the hospital administration. But tonight had changed that. Tonight, muscle memory had overridden discretion, and there was no putting that genie back in the bottle. I was in the military, she said finally. Dr. Martinez leaned forward. What branch? Army. Medical Corps? Rachel nodded. Combat medic. How long? 6 years. 3 deployments. The words felt strange in her mouth after years of silence. She'd gotten so used to deflecting questions about her background that speaking the truth felt like a foreign language. Dr. Mitchell was studying her with new eyes. Combat medic training doesn't usually include emergency thoracostomy. No, Rachel agreed. It doesn't. So where? Rachel met her gaze. Special operations. The words hung in the air like smoke from a battlefield that existed only in memory. Dr. Martinez's coffee cup stopped halfway to his lips. Dr. Mitchell sat back in her chair. You were Special Forces Medical? 18 Delta, Special Forces Medical Sergeant. Dr. Mitchell whistled softly. I had no idea those positions were open to women. They weren't, officially. I was part of a pilot program. 47 women total made it through the training. And you performed procedures like that? In places you've never heard of, under conditions you wouldn't believe. The conversation in the break room lasted until dawn. 3 years of careful anonymity unraveled in the space of 2 hours, replaced by something Rachel had never expected to find in civilian life: understanding. Dr. Mitchell had done her residency at Walter Reed, treating wounded warriors from Iraq and Afghanistan. She'd seen the kinds of injuries that required the skills Rachel had demonstrated. Dr. Martinez's brother was a Marine veteran who'd come home from deployment with stories that sounded like the classified operations Rachel couldn't talk about. Why didn't you go into emergency medicine? Dr. Mitchell asked. With your background, you could have been a trauma surgeon. Rachel was quiet for a moment. I tried. Did 2 years of medical school after I got out. But? The nightmares got worse. PTSD. I couldn't handle the pressure of life and death decisions anymore. At least, I thought I couldn't. Until tonight. Dr. Martinez shook his head. You saved that man's life. If you hadn't acted when you did, he would have died, Rachel finished. I know, that's why I couldn't just stand there and watch. So what happens now? Dr. Mitchell asked. Rachel had been wondering the same thing. Her carefully constructed civilian identity was blown. The hospital administration would have questions. There would be reports to file, procedures to review, protocols to examine. I don't know, she admitted. I guess that depends on whether you're going to report me for practicing outside my scope. Dr. Mitchell and Dr. Martinez exchanged glances. Report you for saving a life? Dr. Mitchell said. I don't think so. But the administration will hear that a nurse with extensive trauma experience recognized a life-threatening condition and took appropriate action to save the patient. They don't need to know the specifics of that experience. Rachel felt something she hadn't experienced in years, relief, not just from avoiding professional consequences, but from finally sharing the weight she'd been carrying alone. Word traveled fast in hospitals. By the end of the week, everyone at St. Mary's had heard some version of the story. The quiet night nurse who'd performed an emergency procedure and saved a life. Details varied in the telling, but the core remained the same. Rachel Martinez wasn't who they'd thought she was. The construction worker, Tom Bradley, made a full recovery. When he learned what had happened, he asked to meet the nurse who'd saved his life. "I don't remember much," he told Rachel when she visited his room before discharge, "but they tell me you're the reason I'm going home to my kids." "I just did what needed to be done," Rachel replied. "No," Tom said, gripping her hand. "You did something extraordinary. Thank you." After he left, Rachel found herself thinking about the words. Extraordinary. For 6 years in the Army, extraordinary had been the baseline expectation. Lives depended on going beyond what was possible, finding solutions that didn't exist in textbooks, performing miracles with whatever tools were available. In civilian nursing, extraordinary wasn't expected. It was often discouraged. Stay in your lane, follow protocols, don't step outside your scope of practice. For 3 years, Rachel had been content to work within those boundaries, but boundaries meant nothing when someone was dying. Dr. Mitchell approached Rachel 2 weeks later with a proposition. "The hospital is starting a new trauma response team," she explained. "Advanced practice nurses working directly with physicians in critical situations. We need someone with your experience." Rachel hesitated. "I'm not an advanced practice nurse. I don't have the credentials. We can arrange for you to complete a trauma nurse practitioner program. The hospital will pay for your education." "Why?" "Because what you did that night wasn't luck. It was training, experience, and instincts that you can't teach in a classroom. We need that expertise." "And my background? Your military service makes you more qualified, not less. We want nurses who can think under pressure, who can make critical decisions when seconds matter." Rachel thought about the offer for several days. For 3 years, she'd been content to remain invisible, to use only a fraction of her skills. But that night in Trauma Bay, too, had reminded her of something she'd forgotten: the satisfaction of saving lives, of using everything she'd learned to make a difference. "I'll do it," she told Dr. Mitchell, "but I have conditions." "Name them." "No media attention, no publicity. I'm not a poster child for women in combat or military nurses transitioning to civilian care. I just want to do the work." "Agreed. And if the nightmares come back, if the PTSD gets worse, we have resources, counseling, support groups, whatever you need." 2 years later, Rachel Martinez was the lead trauma nurse practitioner at St. Mary's General Hospital. She'd completed her advanced degree, specialized in emergency medicine, and become the person other nurses called when situations got complicated. She still worked nights, but now it was by choice rather than necessity. The darkness no longer provided cover for her past. Instead, it was when she did her best work, when the skills she'd learned in places that didn't exist on maps could save lives in trauma bays that did. The nightmares still came sometimes. The sound of helicopters could still trigger flashbacks to dusty forward operating bases. But therapy had taught her that carrying the weight of her experiences didn't mean carrying it alone. She'd started a support group for medical professionals with military backgrounds, nurses, doctors, technicians who'd served in combat zones and struggled with the transition to civilian health care. They met monthly, sharing stories that couldn't be told anywhere else, finding strength in shared experience. "The thing about coming home," Rachel told the group during one meeting, "is that you never really leave the battlefield. It follows you, becomes part of who you are. The question isn't how to forget it, it's how to use it." Dr. Martinez, now in his 3rd year of residency, had become one of her closest colleagues. "I still can't believe I told you that you couldn't perform that procedure," he said one night during a quiet moment in the ER. "You were following protocol," Rachel replied. "That's what you're supposed to do. But you knew better." "I knew different. Sometimes that's enough." On quiet nights, when the hospital settles into the rhythm of healing sleep, Rachel still makes her rounds. But now she walks with purpose that has nothing to do with invisibility. She's no longer hiding from her past. She's honoring it by using every skill, every lesson, every hard-won piece of wisdom to serve others. The construction worker, Tom Bradley, sends her a Christmas card every year, a photo of his family, a note thanking her for giving him the chance to watch his children grow up. She keeps them all in her locker, reminders of why the weight she carries is worth it. Sometimes the younger nurses ask her about her military service, not the details, they sense those are protected territory, but about the transition, the adjustment, the challenge of using combat medical skills in civilian life. The training never leaves you, she tells them, but it's not just about the procedures or the technical skills. It's about learning to trust your instincts, to act when action is needed, to carry the responsibility of someone else's life without letting it crush you. How do you do that? They ask, one patient at a time, one shift at a time, one decision at a time. Rachel Martinez never wanted to be a hero. Heroes get attention, and attention was something she'd spent years avoiding. But heroism isn't about wanting recognition. It's about doing what needs to be done when someone's life hangs in the balance. Behind the closed doors of St. Mary's General Hospital, in the quiet hours when the city sleeps and the vulnerable need protection, Rachel continues to fight. Not against enemy combatants or insurgent forces, but against death, against suffering, against the kind of helplessness that steals hope from families waiting in hospital corridors. She fights with hands that remember battlefield medicine and a heart that never forgot why she chose to serve. Some battles end when the shooting stops. Others continue in trauma bays and intensive care units, fought by people who've learned that healing can be its own form of warfare. The Frontlines never really end. They just move from foreign deserts to hospital corridors, from combat zones to places where ordinary people face extraordinary crises. And sometimes, if we're lucky, there's someone like Rachel Martinez standing ready, carrying skills forged in war, wielded now in service of peace. The patient was dying. The surgeon was 10 minutes away. But the night shift nurse did something that saved a life and revealed a truth that had been hidden for 3 years. Some things you never forget. Some people never stop fighting. They just find new battles worth winning. So I ask you, have you ever been cared for by someone whose story you didn't know? Someone whose gentle hands carried strength forged in places you've never been? Share your experiences in the comments, because here at Hidden Legends, we believe the most powerful stories are often carried in silence by people who never ask for recognition. If this story moved you, subscribe and share it. Help us honor the hidden heroes who serve in hospitals, schools, and communities everywhere, carrying expertise earned in extraordinary circumstances, using it now to protect and heal in ordinary moments that mean everything to the people they save. We'll see you in the next legend. And until then, remember, your nurse might be someone who's already fought battles you'll never know about, bringing that warrior spirit to the bedside where it matters most. Service never ends. It just finds new ways to save lives.